My name is Meaghan Adams. I'm a physiotherapist at Grand River Sport Medicine, and I get to talk today about recovering from concussions and how to prevent them in the future. So when you look at these two pictures, you know that the rugby player is not going to be back for his next game. But what about the hockey player? Because concussions don't look like serious injuries, sometimes we are tempted to treat them like they're not. But they can be. And just like broken bones, concussions need time, and sometimes they need a little bit of help to get better. Concussions are sometimes called invisible injuries, but they're still injuries, and we need to treat them seriously. We use rehab for a lot of different injuries, including muscles, bones, and ligaments, and the brain. When we're talking about getting back to playing hockey after a concussion, we want to make sure that an athlete gets better as quickly and as safely as possible, and we want to minimize the chance of getting another concussion if we can. Returning to play is always the most important thing for any athlete after an injury. After a concussion, we follow a 6-step return to play program. Working gradually through those steps, make sure that you get better completely and that you're able to return at 100% back to your team. We start with rest, move on to cardiovascular or aerobic activity, move on to sport-specific activity, then drills, practices, and games. It's important to remember, though, that a concussion isn't something you can push through. That will make you feel worse and take longer to get better. So the first step is rest. This is the hardest, but it's also the most important step. You need to feel 100% normal doing nothing at all, and then doing your regular daily activities before you can add in your sport activities. Sometimes this means you need to take time off of school or give up your cell phone or computer or video games just for a little while until you feel like yourself again. Once you can feel normal at rest, we work on raising your heart rate, usually on a stationary bike. Once that feels normal and you're okay with that, we return you to skating. No stick, no puck, just getting used to being on the ice again. From there, we work on drills on and off the ice. Then you can return to practice. And once you've been cleared by a doctor who has experience in dealing with concussions, you can go back into a game. When we design a concussion rehab program for an athlete to work through these 3 steps, we have 4 main goals. We want to maintain aerobic fitness. So that's your cardiovascular capacity, your ability to work hard. We want to make sure you keep that. We want to retrain your physical skills. Things like balance or stick handling. We want to retrain your reflexes. This is especially important if you're a goalie. And we want to treat or strengthen any soft tissue injury that might have occurred in your neck when you got the concussion. Everybody always wants to know how you prevent a concussion from happening. While we don't have any really good strategies, there's a few tips to remember. The first one is your helmet. Your helmet is really, really important to prevent all kinds of head injuries, things like fractures or bleeding in your brain. But helmets aren't always great at preventing concussions. Sidney Crosby got his concussion with a helmet on. We know helmets aren't perfect at preventing concussions, but they're a lot better than not wearing anything at all. So to make sure your helmet is doing the best job it can, you want to make sure it fits. Your helmet should be 1 or 2 finger widths above your eyebrows. It should come all the way around to the back of your head. Your cage or your mask should be 2 or 3 fingers away from your nose. And the strap of your helmet needs to be snug under your chin. It's also important to look at the expiration date sticker on your helmet. If your helmet is past its best before date, it's time to think about getting a new one. And most importantly, you need to wear it. There's been some argument about mouth guards over the past few years and whether they do anything to prevent concussion. Right now, we can't say that they do, but mouth guards are really important to prevent injuries to your teeth and to your gums, so you need to make sure that you wear one. This is a video from Think First Canada talking about different tips and strategies to help keep you and your teammates safe on the ice.
Most of us have grown up watching cartoon characters getting bonked on the head. But in real life, feeling dazed isn't funny.
A concussion is called an invisible injury because we don't see anything. There's no bruising on the head. There's no broken bone that we can see. So in that sense, it's invisible.
Anyone showing symptoms of a concussion needs to be taken off the ice right away. Continuing to play or practice increases the risk of more severe problems. It can take longer to get better, increase the risk of another injury, and can be dangerous.
How you feeling?
It was thought before that the only way to get a concussion is if you actually passed out, but now we know for a fact that you don't need to get that level of symptom. You can have concussions simply from, not feeling well, a little bit dizzy and headaches.
When the brain gets hurt, you'll feel one or many of these symptoms: confusion, headaches, loss of balance, nausea, blurred vision, ringing in the ears, slurred speech, emotional and personality changes like feeling sad or moody, dizziness, stunned or dazed, loss of consciousness, and memory loss. Remember, you don't have to lose consciousness to have a concussion. Even if you only have one of these symptoms, you might still have a concussion.
We can drastically reduce the number of concussions in hockey by people respecting their own brains and respecting the brains of their opponents.
So let's continue to enjoy this amazing sport for life. And remember to think first. For more information, visit the Think First website at www.thinkfirst.ca.
You can find more information on our website, www.grsm.ca, on Facebook, just search for GRSM, or on Twitter, at GRSM_CA, or you can find us at any one of our 3 locations in Kitchener and Cambridge. So I'm Meaghan Adams from GRSM, and I look forward to seeing you out on the ice.